Mental health nursing, unit 5, sexual disorder. Okay. According to ICD-10 classification, sexual disorder is coming at a classification of F6. Okay. So what is a classification? What are the disorders we will be discussing in this unit? Fine. So as per ICD-10 classification, there are four classification of sexual disorder. Four classification of sexual disorder. First one is gender identity disorder. Gender identity disorder. Second one is psychological and behavioral disorder. Psychological and behavioral disorder. Third one is disorder of sexual preference. Disorder of sexual preference. Next one is sexual dysfunction. Okay. So there are four classification, and in this under there are some few under classifications which we will be discussing now. Okay. First one is gender identity disorder. Fine. Gender identity disorder as per ICD-10 classification, it is F6. Okay. F6. In gender identity disorder also there are four classification. Don't get confused. Sexual disorder is classified into four, and in that first one is gender identity disorder. In gender identity disorder there are again four classification. First one is transsexualism. Transsexualism. What is transsexualism? Like, it is a disorder. Fine. There is a persistent and significant sense of discomfort regarding one's anatomical sex organ and feeling that inappropriate to one's perceived gender. The person will be preoccupied with the wish to get rid of one's genital and secondary characteristics and to adopt the sex characteristics of others. Nothing. Transsexualism means the person is not anatomical sexual organ, what is it? He is not satisfied with that. He wish or she wish to have the opposite sex anatomical structure. Okay, that is known as transsexualism. This is a disorder. Okay, that means the person is not feeling a discomfort with one's own anatomical sex preference and wanted to or wish to have the other person's sex anatomical sex wishes. Okay, what will be the treatment for this? For treatment for sexualism is transsexualism is counseling. Okay, then or else if the person is very much discomforted, we will be doing a surgery. Okay, sex changed to the desired sex of the person. If the person is wishing to become a girl, with the surgery change, he or she can become a girl. Or if a person is liking to become a boy, after the surgery, he or she can become a boy. That is the treatment of transsexualism. Next one is gender identity disorder of childhood. Transsexualism, you know, right? That same thing from childhood, if it is there, that is known as gender identity disorder of childhood. Okay? And with the early age of onset, from 2.5 years, 3 years and all, this person will be visioning or wishing to have other persons. He or she is not satisfied with one's own anatomical structure. Okay. That starting from childhood is known as gender identity disorder of childhood. So in gender identity disorder, two we have discussed. First one is transsexualism. Second one is gender identity disorder in childhood. Okay. Third one is dual role transvestism. Dual role transvestism means it is a characteristics, okay, wearing clothes of an opposite sex in order to enjoy a temporary experience, okay, but without changing the permanent sex change. The person don't want to permanently change his sex organ, okay, but he likes to wear the opposite sex dress. Okay, that is known as dual role transvestism. Fine. Next one is the in gender identity disorder. The last one is intersexuality. Intersexuality means the person have gross anatomical or physical features of other sex. Okay, congenital adrenal. Okay, intersexuality means the person by birth only some of the anatomical features is different from the other sex. Okay, that is known as intersexuality. Fine. So in sexual disorder, first one was gender identity disorder. In gender identity disorder, 4 classification: transsexualism, gender identity disorder of childhood, dual role transvestism, intersexuality. Fine. Next, we are moving on to psychological and behavioral disorder. In psychological and behavioral disorder, the first one is homosexuality. Homosexuality. Homosexuality means sexual relationship is maintained between the same sex. A girl is having sex with a girl, which is known as lesbians. Okay, a male is having a sex with a male, which is known as gay. Okay, so what will be the treatment given for homosexuality? We can give behavioral therapy. Okay, we can give supportive therapy, psychoanalytical therapy. This therapies and all we will be discussing later. So it will be helpful for you to understand. Fine. And we will be giving counseling and all for the patient. That is known as homosexuality. Okay. Next one is the third classification, disorder of sexual preference. Sexual disorder, third classification, disorder of sexual preference. In disorder of sexual preference, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 classifications. Okay, we'll discuss one by one. First one is fectism. 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 Fectism means a person seeing a non-living object, the person sexually get arousal or get active. That is known as fectism. See if the person is standing here and he sees that in the other building there are non-living objects such as underpants, shoes, gloves, bras. Okay, seeing that the person is sexually getting active. That is known as fectism. Okay, sexual arousal occurs by seeing a non-living object. Next one is transvestism. Transvestism is already we said it is same as dual role transvestism, wearing the opposite sex clothes. Okay, that is known as transvestism. Next one is sexual sadism. Sexual sadism means a person is sexually aroused physically and psychologically, okay, by injuring the partner. Okay, the sex partner, the person likes to injure them. Okay, and when that in that pain, when they cry, the person is getting satisfied. That is known as sexual sadism. Okay, harming the partner. Next one is sexual masochism. 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 Sexual masochism means the person opposite of sadism. In sadism, what they do? They harm the partner. In masochism, what they do? They harm themselves. For sexual arousal, they harm themselves. When a cigarette or something is there, they put it in their hand. Okay, and when that pain is coming, they will be sexually satisfied. Then that is harming self. Sexual masochism. Next one is exhibitionism. Exhibitionism means showing. Okay, what is exhibitionism? A person is sexually aroused by exposing his or her genital organ to an unknown person. Okay, to a stranger person. When they show, they will feel okay, they are sexually aroused or sexually active. That is known as exhibitionism. Fine. Next one is voyeurism. 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 Voyeurism means recurrent tendency to see an unknown person naked. Okay, or knowing person or something. Just the person has to see that person naked repeatedly, recurrently. That is known as voyeurism. Okay. Next one is fructism. FROTTEURISM. Fructism. Fructism means chumma the person is going away, just touching or rubbing. Okay. If they rub their hand like this, they will be sexually active. That is known as fructism. Okay. This is a persistent or recurrent involvement of act of touching or rubbing, okay, against a non-consenting person. That person may not be thinking that way also, but sometimes they just touch like this, and that sexually they are getting active. That is known as proctism. Okay. Next one is pedophilia. Pedophilia. P-E-D-O-P-H-I-L-A. Pedophilia means involvement of an adult in a sexual behavior or sexual activity to a pre-pubertal child. You might have seen in newspapers and all, small kids and all getting raped and all. That is because of pedophilia. Okay. The adult is getting involved with sexual activity recurrently to a small baby is known as pedophilia. Next one is zoophilia. Z-O-O-P-H-I-L-I-A. Zoophilia. Zoophilia means sexual activity of an adult with a animal is known as zoophilia. Now you people will be like, what is this? What is ma'am saying? It is right. Usually it happens all over the world. So it's a disorder. Don't get weird thinking and all. Why is this? This is there in your syllabus. That's why I am taking. This is a disorder of sexual disorder. Fine. Next one is other paraphilias. The last one disorder is other paraphilias. Comes under sexual arousal occurring by seeing urine, stool, okay, or by giving enema. The person is having sexual arousal. The person is getting sexually active. That is known as other paraphilias. Okay. So disorder of sexual preference. 10 characteristics are there. First one is fectism. Fectism means what? Is sexually aroused by seeing a non-living object. Transvectism, opposite sex clothes. Sadism, while doing sexual interaction, the person is harming the partner. Masochism, harming self while doing sexual interaction. Exhibitionism is like exposing the genital area to a stranger. Voyeurism means recurrently you want to see a stranger naked or getting involved in a sexually. Proctism means just by persistent touching or rubbing or something, the person is getting sexually active. Pedophilia, adult is involved in a sexual activity with a prepubertal child. Okay, for a sexual pleasure is known as pedophilia. Zoophilia, for sexual pleasure, the adult is getting active with the animal is known as zoophilia. Other paraphilias is like sexual arousal of an adult by seeing urine, enema, stool and all is known as paraphilias. Okay. The last categories is sexual dysfunction. Okay. Sexual dysfunction comes in ICD-10 classification of F5. Okay. The common dysfunction is frigidity. F-R-I-G-I-D-I-T-Y. Frigidity. Frigidity means absence of desire for having a sexual activity. The person don't have any desire to have sexually interacted. Okay. That is a disorder. Frigidity. Okay. Impotence. Impotence means the disorder, inability to have a penile erection until completion of satisfaction of sexual activity. The penile is not getting erected for a sexual activity. It is a disorder which is known as impotence. Okay. Next one is premature ejaculation. Premature ejaculation means ejaculating the semen, okay, before the sexual activity is getting over. Okay. That is known as premature ejaculation. Next one is non-organic vaginism. That means involvement of spasm. Spasm means the muscle is not getting, muscle is very much rough and all. Okay. So the person is not, whenever the person is having sexually contact, the person is getting pain. That is known as non-organic vaginism. Non-organic dyspareunia means pain in the genital area. It can happen for male as well as for the female while the time of coitus or the time of intercourse. Okay, in the time of intercourse, if the person is, the male or the female is having pain in their genital area, is known as non-organic dyspareunia. Okay. What is the treatment of this is psychoanalysis, hypnosis, group therapy, behavioral therapy. Okay. In this also nursing intervention is there. That is homework for you people. Okay. So here ends your sexual disorder category. Sexual disorder is classified into 4: gender identity disorder, psychological and behavioral disorder, disorder of sexual preference, sexual dysfunction. Okay. in this certain categories is there, we have discussed already. Notes will be updating for you people. So I hope you understand the unit. If any doubt is there, please get clarified with me. Okay, thank you.